I'm Dr. Jeff Howard, Commissioner for Public Health. I hope that each of you are finding the new year enjoyable and productive. In today's Public Health Minute, I'd like to discuss an issue I care deeply about resolving, the opioid crisis and what Kentucky is doing to respond. Over the past decade, the number of Kentuckians who die from drug overdoses has steadily climbed to more than 1,500 per year, exacting a devastating toll on families, communities, social services, and economic growth. This is an issue that affects or involves Kentucky public health as well as the medical system. Growing up in eastern Kentucky, as a child of parents suffering from substance abuse disorder, I have firsthand experience of the devastation that accompanies this disease. While this epidemic remains daunting, we are starting to see our prevention, treatment, and recovery support strategies make a difference. That's encouraging, especially due to our state's history with prescription opioid addiction and increasingly easier access to drugs like heroin and fentanyl derivatives. If we are serious about improving our state's health, we have to get a handle on opioid addiction and its associated health problems, such as the spread of infectious disease and overdose deaths. The numbers are truly alarming. Overdose deaths now outnumber deaths from car accidents. Children are being removed from homes in record numbers, and our child welfare system is struggling to keep up. Too many babies are born physiologically dependent on opioid agonists, and infectious diseases such as hepatitis A and C are spreading at such an alarming rate our public health system is working overtime just to keep up. The list could go on and on. However, I am optimistic about what I see in terms of the great work and tireless dedication among the many healthcare professionals, leaders, and policymakers, and the everyday people willing to lend their time and energy to solving this crisis, because they, like me, have personally been affected in some way. The Commonwealth has implemented a number of programs and policy initiatives, including the statewide use of a prescription drug monitoring program, expanded availability of substance abuse treatment opportunities, and various laws to address this problem. Still, we struggle to connect individuals to the treatment that they need when they need it and when they are ready to focus on recovery. This is where you can help. A new website provides a vital link for Kentucky healthcare providers, court officials, families, and individuals seeking options for substance abuse treatment and recovery. This site, findhelpnowky.org, offers a real-time information resource about available space and treatment programs and guides users to the right type of treatment tailored to their individual needs. The findhelpnowky.org locator contains treatment providers and treatment openings across the Commonwealth of Kentucky, including community mental health centers, private, nonprofit, and faith-based treatment providers, and providers of medical-assisted therapy. The treatment locator also contains information, an information center to help answer questions about substance abuse treatment and recovery resources. If you are a substance use disorder provider and are interested in listing your services, send an email to info@findhelpnowky.org for more information. I look forward to the day when issues like opioid addiction have been resolved, a day when infants aren't born experiencing symptoms of withdrawal, and older children and teenagers don't experience the trauma of being separated from their parents because of substance abuse. I look forward to the day when all those suffering from substance abuse are in recovery and back to being healthy and productive citizens, helping us in our work to make this great state even better. Let's make a commitment to work together to prevent more individuals from suffering from this disease, to better identify those in need of treatment, and to support services to ensure those in recovery are successful. Thank you.